Hello, this is Beth here, Lead Nurse Educator at International RN. So I'm an experienced nurse here in the UK, and I have been teaching OSCE and doing overseas recruitment of overseas nurses for about 60 years. I also teach the CBT exam. In 2024 is when I made my own company of International RN. If you'd be interested in taking a course with us, please check out our website. Or if you want more tips and other videos for your OSCE exam or CBT exam, please check out our social media and YouTube channel. Okay, and as always, good luck with your exam. Hello, so in this video we're going to go through the PHQ 9 questionnaire and what it is for the OSCE exam. So this appears in both the adult and mental health exam. So as part of the adult exam, it will appear as part of your community assessment. If you have one of the community patients, you might have this. And for mental health, you're always going to have this as your assessment. And if you get selected for the talking therapy skill, you will also have this. So what is the PHQ? So basically it's a questionnaire for patients who are depressed, and they fill it out and it basically rates how severe their depression is, and then it gives like treatment recommendations for them. So what you'll have in the exam is the questionnaire will already be pre-filled for you. So the patient would have gone through and filled it out themselves. Okay, so there's no need for you to ask the patient every single question and get the answer and fill it out on the chart. That would be quite time consuming and you don't have enough time for that. And also we don't really want to be rushing these kind of patients, really. It's not very sensitive. So you can see on the chart, it asks the patient to rate how they've been feeling over the past 2 weeks. And then they will give a score of 0 for no, not at all, and 3 for most days, okay? And those will already be filled out. So what you then need to do is make a total of each column. There's a box at the bottom where you total each column, and then you make a total score overall. So then you will flip your chart over, and on the back of the chart you have the provisional diagnosis and the treatment recommendations. So you need to talk those through with your patient. Okay, so you can see if the patient scores between 5 or 9, they have minimal symptoms, and the treatment recommendation for that is support, and then for them to call you if they get worse within a month. So you just need to explain that to the patient. That's all you have to do. So if they get between 12 and 14, that's minor depression. So treatment recommendation is support, watchful waiting, antidepressants and psychotherapy. So you'd say something like, so with the result of your PHQ score, we can see you've got minor depression. So we are going to give you some support. I'm also going to talk to doctor if we can get you some antidepressants and psychotherapy. Okay, so if the patient's scoring between 15 and 19, this is major depression, and the treatment recommendation for that is antidepressant and psychotherapy. Okay, and if they're scoring 20 plus, that is severe depression, and the treatment recommendation for that is antidepressant and psychotherapy, especially if not improved on monotherapy. So other thing I would recommend you to do for this station is if you've noticed the patient is scoring 3 in any areas, obviously that's something that's affecting them quite a lot, nearly every day. You can go through and discuss that. If you do have this presented to you as part of the talking therapy station, we do have another video on that, so please check that out because it's slightly different what you need to do as the next step for the talking therapies for mental health exam. And as always, good luck with your exam.